Have you ever wondered if you can make your penis bigger safely and what to do if your stream goes in all different directions? Well, welcome back today to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon. And today we're going to be going over our Ask Me Anything series. So without further ado, let's get to our first question. Now, if you want your question answered, make sure to check out our membership at renamalik.supercast.com, where you can join to be a member and get early access to our podcast episodes, as well as Ask Me Anything to get your question featured on our monthly Ask Me Anything episodes.
First question. I get too lost in my own head with women. I think too much about staying hard during sex, and it causes me to sometimes lose my erection because I think I overthink my erection. I'm only 24. I can't imagine I have a disease that's causing me to have erectile dysfunction this early in life. I do get dates, so I'm not having problems finding partners to have sex with, but I overthink the sex part because I want the women to think well of my performance, and I've already lost my heart on with 2 separate women. I don't want this to happen again. This question's from TS.
Okay, TS. So this is unfortunately a very common issue. So when a man has an issue with an erection, which invariably happens to everybody in their lifetime, erectile hardness will change over time depending on how stressed you are, what the temperature might be like, how much you had drink, or what other things you ingested that day. So these things can all affect erectile function. Now, the first time you lose an erection, it's very stressful. And obviously part of this is that we're not taught that men's erections can, be variable and fluctuate over time. So one, I want you to know that your experience is completely normal. And then what happens is you get stressed about not being able to get an erection. And the next time you go to have intercourse, you're just thinking about, am I going to get an erection? Am I going to be able to maintain it? Am I going to be able to have sex? Instead of actually enjoying the pleasure with your partner. And it leads to this vicious cycle, right? Because then you don't get an erection or the erection doesn't last. And now you're more anxious for the next time you have sex. And it just keeps going and going and going. So one is, yes, 24-year-olds, it's very uncommon to be dealing with organic ED. But interestingly, when they've looked at men under 40, 87% of them had a medical issue causing their erectile dysfunction. So even if we think it's largely in your head, it's really important to go see your primary care doctor to get evaluated, because sometimes having issues with erections can be a warning sign of future heart disease or cardiovascular issues, because blood flow to the penis is going through smaller arteries than the blood flow that goes to the heart. So the first time you see issues will be in your penis, likely before you see issues with your heart. Now, what can you do? Let's answer the question, right? What can you do? So first off, when you look at people who have issues with psychogenic erectile dysfunction, it can be very helpful to see a specialist. So see a psychologist who has expertise in this, or a sex therapist who can help you sort of deal with your stress and anxiety around sex. That's very, very important. Now, the things that sometimes people can try if you're in a relationship where you're able to communicate with your partner about sex and feel comfortable is to try to take penetration off the table for a short period of time. So for the first time you get together with your partner, you want to sort of say, hey, we're just going to explore each other's erogenous zones. We're going to feel each other. We're going to touch each other. We're going to enjoy each other, but we're not going to stimulate genitals, so that you can start focusing on the feelings and the sensations. And then as you start noticing you're comfortable with that, you're not thinking about your erection, you then start touching genitals. And then once you start feeling comfortable touching genitals the next few times, then finally you start going back into having sex with your partner. The other thing you can do is you can obviously talk to your primary care doctor or urologist about trying a medication to help you. Now, these medications like sildenafil, tadalafil, or vardenafil, these medications help you make it easier for you to get an erection. Now, you still need stimulation to start or ignite the erection, but they will help you maintain it. And while you're sort of dealing with all these issues and trying to regain your confidence that you can get an erection and maintain it, it can be helpful to use these for a short period of time to help, again, regain that confidence. So these are just a few things, but you can check out my full YouTube video on psychogenic erectile dysfunction to learn more about this issue.
All right. Second question is actually from one of our Supercast members. It's not worded properly, so I'm just going to summarize it. He's questioning if in the adult industry that, if these performers are born with these large penises, and he's questioning if that's true. So he's thinking that, are they using some type of enhancements, some surgeries, some herbs, some techniques? Like, what are your thoughts? Maybe we can just answer from a place of, what are some of these enhancements that if they are using them, what would they be? And what questions men may have about enhancements.
Absolutely. So one, I think it's important to realize that people who choose to be actors in the adult industry choose to do so because they have certain anatomical features, right? The average penile length is about 5.4 inches worldwide, and 99.7% of people will have a penis that's smaller than about 7.5 inches. So that's just to give you scale of what average is. Now, in terms of these men in pornography, in terms of, their penile length or girth, obviously, the camera can be used to use certain angles or be closer or to the genitalia to make it look and appear larger. These men tend to, at least to my understanding, don't have actual surgeries to enhance the length or girth of their penis. Well, however, you can get fillers to enhance girth, and you can use traction devices to maximize length to a small degree, which can be helpful in some people. They also will often use medications or pharmacologic agents to help them maintain erections for long periods of time. So they may use medications like sildenafil or tadalafil or vardenafil, or they may even use what's called intracavernosal injections, where they inject medication into the penis that causes increased blood flow to allow them to have an erection very quickly. Some men will even have an inflatable penile prosthesis inserted, which essentially allows you to have an erection for as long as you so desire. Now, this does not make your penis longer. It is a treatment for erectile dysfunction, but it does have the bonus of allowing you to have an erection last as long as you'd like it to. So yes, absolutely, the adult industry is one selecting people who may be on the end of the spectrum in terms of larger genitalia. They may be using camera tricks to make things appear larger than they are, and they may be using pharmacologic enhancements or even genital enhancements to increase width or length or duration of their erection. I think the reality is that the adult industry is not indicative of what real sex is like. Real sex is not what they're showing you. They're showing you something that is meant to entertain, meant to shock, and meant to get you interested in watching more pornography. So it's not necessarily indicative of real sex. It should not be used as a surrogate for sex education or as a way to compare yourself to what you're seeing on there, because they are not the average human.
And you've covered some of those videos in the past with traction and some of the vacuum pumps, so please do check those out as well. There's a third question. I'm going to ask a follow-up question with it, since it's a topic that gets covered quite a lot in our comments. Sometimes when I pee real hard, the pee splits into two streams. What do you think is happening there? This is from initials GV. But as a follow-up question, I do see comments asking questions about sometimes my pee goes to the right, it goes to the left, it goes all over the place. What's the deal with that?
There's a few things that can cause what we call a split or deviated stream, right? So when men urinate, one, you have to think about it like a hose. So when you have a hose that has no blockage, the flow comes out strong and straight and no problem. But the second you put your finger on the hose, right, the spray goes all over the place. So anytime there's a blockage in the tube where urine comes out, you're going to have a split or deviated stream. So what can cause blockages? Very commonly, men who have an enlarged prostate will have some degree of blockage for the urine between when the urine leaves the bladder to outside the body. So that can cause a split stream. Also, if you have a narrowing in the urethra, now that's less common, but certainly we do see it. So if you're noticing a weak stream, a split stream, maybe you're straining to urinate or you're pushing to urinate, or you find that it just takes you a long time to start or it stops and starts, it's really important to see a urologist to get evaluated, because we have really great treatment options to help both of these issues. And I've covered BPH many times on my channel. We'll link some of the episodes in the show notes and in the description so you can check them out to learn more about BPH. The other thing is that sometimes when you ejaculate, you will have a little bit of semen left over in the P tube or in the urethra. This can also act as sort of a blockage, which then you notice after you ejaculate, that first few times you pee, you may have a split stream. So it's very, very common. I recommend, if everything else is great in life and this is the only thing that bothers you, absolutely, it's still worth seeing a doctor for, but you can obviously sit to pee, which I know is not as common in the US, but places like Germany, almost all men sit to pee. So it is very common, can make it a little easier to manage, and overall still maintain a good quality of life. If you want to hear the rest of the Ask Me Anything episode, make sure to join our premium membership at renamalik.supercast.com. There you can get access to Ask Me Anything, to get your question featured on our future episodes, and to access ad-free episodes and early access to all our episodes, as well as transcripts from the podcast. And as always, remember to take care of yourself because you're worth it.